This Picmonic discusses interventions for DIC and is a continuation from the assessment card, in which a game involving dice went wrong. When learning about DIC, it is important to keep in mind possible complications. With hypovolemia, there is a risk for shock, shown by the shock from the outlet causing a dead kidney, which represents the possibility for renal failure. Because DIC occurs as a result of another process, treating the underlying cause is key, shown by the winged creature attempting to treat the underlying attacker and shouting, "Stop making new thrombi," which is a mnemonic to remember common causes of DIC: sepsis, trauma, obstetric complications, pancreatitis, malignancy, nephrotic syndrome, and transfusion. The rescuer is also placing his wing to apply pressure to manage bleeding, as patients will often be placed on strict bleeding precautions. The guy is taken to a safe place to receive more care, including administration of fluids to balance the blood pump system scale, as maintaining fluid and hemodynamic balance is another important intervention to prevent shock. For serious bleeding or hypovolemia, a transfusion may be necessary, shown by the transfusion IV. With hypovolemia, patients may become hypoxic. Thus, proper oxygenation is important, shown by the O2 tank blowing air and trying to comfort the patient. Lastly, in certain situations, such as if the patient is identified to be at risk for DIC or is in the very early stages of clot formation, a heparin drip may be started if the benefits outweigh the risks, and is shown by the hippie heron dripping a tear concerned about his friend. So to summarize, DIC interventions include being aware of complications such as the risk for shock or renal failure. One should treat the underlying cause, manage bleeding, and maintain fluid and hemodynamic balance. A transfusion may be necessary, as well as providing oxygenation. In some circumstances, a heparin drip may be initiated.
After playing a dangerous dice game, this player lost and it started dragging him into the game like Jumanji. In an act of desperation, his kidney leapt from his flank to unplug the game, only to be shocked and die. The player thought he was doomed, as creepy hands and claws continued pulling him underneath the board. That's when he heard the voice of his savior. "You stop making new thrombi, man!" And feathery fingers smacked the underlying hands away, while another wing managed his bleeding flank with pressure. The player was pulled away and given fluids, and as he sipped, his blood pump system raised, coming into balance, and a way out of the horrible room was opened. He leapt into his hero's embrace to feel the warmth of an IV transfusion, and the calming breeze of an oxygen tank. His hero, Hippie Heron, saw that he was obviously traumatized by the experience, and let drip a single healing tear. "Everything's gonna be alright, man,"